Hello, my name is Atherton, and I'm doing Client 2 case study about the moral behaviours and judgments that allow us to evaluate actions from right to wrong. Decisions are impacted by culture, values, and relationships, and are governed in Australia by APRA and the APS. The APS created a code of ethics which has three general principles that act as umbrella terms for more specific ethical standards. These are respect, propriety, and integrity. In the case study, I'm a clinical psychologist. I'm currently seeing Steve, who is in his 50s, shy, and has a couple of close friends who are currently busy with their families. He works in a trade and is well respected and is a perfectionist. Steve socializes at work due to the professional environment provided. Unfortunately, Steve's mother passed away a year ago. Steve was her carer for multiple years, which allowed him to live in recluse. Steve's mother's death has left a void in his life, making him feel depressed and isolated, and he admits he's needing social contact. Steve has been seeing me for 3 sessions so far. He's mentioned he holds me in high esteem and that he is trying to be a model client. Steve has started asking me to hang out and is trying to build a friendship with me. Steve has added me on social media and has started texting me regularly out of hours. Steve has also started asking me about other clients and comparing himself to them. These case holds focused on all three general principles: respect, propriety, and integrity. As Steve is pushing the therapeutic alliance for more of a friendship, it is crossing boundaries which should have, but weren't, properly established in the initial sessions. Along with pushing the friendship, Steve has asked me about other clients and how he compares to them. Although I haven't fallen for many of his questions, I have slipped and given him some answers which could be potentially identifying other clients. The clear violation in this case is the breach of confidentiality, which can be found in the APS Code of Ethics under Standard A5. The dual relationship that is formed has clouded my judgment from providing a service to chatting with a friend. These actions compromise my competence and reputable behaviour, which can be found in the standard B1.2, B1.4, C1.1, and C3.1 of the Code of Ethics APS. Although it is not illegal to enter dual relationships, it is an ethical violation if the relationships is sexual, which it is not in this case, or it impacts the ability to apply my professional responsibility to prevent harm and provide services that benefit Steve, which is a violation of standard B3, C3.1 of the Code of Ethics APS. Anderson supports this analysis by suggesting that dual relationships cloud professional judgment, leading to vulnerability of the client and breaking trust and the potential to cause harm. To assess these ethical issues, I use Rich's and Keith's ethical decision-making model. Although it is longer than other models, it has a clear step-by-step method to deal with the issues at hand and allows for myself to clearly reflect on the matters that matters. Step 1, determine the ethical issues. These are violations of competence, conflicts of interest, professional responsibility, violations of boundaries, and confidentiality. Step 2, consult the APS ethics guidelines and the Code of Ethics. Step 3, consider all factors that may influence my decision with Steve. This could be cultural, political, community, or personal values. In this case, I would have to consider Steve's welfare. He's already vulnerable, and I wouldn't want him to feel any more isolated than he already does. He's pushing for information that compromises other clients' confidentiality. I would also have to take the responsibility of my profession, my practice, and reputation into account. Step 4, consulting with an experienced colleague. This is recommended in both the guidelines and the APS Code of Ethics, as long as you do not give information to allow identification or you have the consent of the client. In this case, I spoke with the senior psychologist of my practice, Dr. Joe Bloggs. Step 5. Evaluate the rights and vulnerabilities of all parties. Steve has the right to a professional and competent service. My other clients have rights to confidentiality. The practice has rights for terminating my employment. I have the right to speak with Steve to figure out this ethical issue. Step 6. This step is like a brainstorm and should visit all decision avenues. In this case, to name a few, Steve continues sessions as if nothing's happened at all. Steve continues sessions, however, we address the boundaries. Recommend other ways of socializing. Refer to another professional. And lastly, terminate my service. Step 7. Calculate the consequences of each decision. For example, Steve feeling rejected, Steve feeling isolated, destroying the rapport that I built with Steve, destroying the progress, and potential lawsuits. Step 8. This is the last step, choosing the decision. I've chosen a combined of a few decisions and implemented them. I chose to revisit the boundaries with Steve and explain to progress further, we would need to keep our relationship professional, and I would also help him find social groups such as Meetup so he can make new friends. This case study has allowed me to learn a great deal about the ambiguity of the ethics involved with psychological practice. I learned that the initial sessions outlining the terms of the therapeutic alliance is at the utmost importance, and to communicate clearly and all the expectations and boundaries. Having said that, I've learned that dual relationships aren't a black and white situation. It depends highly on certain contexts. For example, having dual relationships in rural small towns is unavoidable. However, these relationships should be approached with caution. As Vera described, ethics are there to make sure each person is treated fairly and not taken advantage of. And a good approach to this is to treat others the way you would like to be treated. Respect. It's a crucial aspect of the ethics, but doesn't apply solely to the client and the psychologist. The respect aspect should apply to the profession, your workplace, and society, even though none of these are inside the room at the time. Using Kuch's 8-step decision model, it has allowed me to realize the importance of critiquing yourself. At every chance, you should be critiquing your thoughts, services, and even as far as your note-taking. This will allow for a reflective practice. The last lesson I learned was to think big. Consider your future, consider all involved, and consider the repercussions. For advice I would give to the early career psychologist for future practice would be to consider your career when making decisions. Each action can impact. Be clear about your professional boundaries, as they can prevent ethical implications. Critique yourself regularly. Make sure you are behaving in accordance to the APS Code of Ethics. Use reflective practice in order to grow and learn. If you're unsure about an issue, ask someone. We're all here to help. Practice beneficence, the act of kindness with the moral obligation of doing good to others. Confidentiality is important. Be very cautious about the information you disclose, and use the Code of Ethics and guidelines provided by APS to solve ethical dilemmas. Thank you very much for listening.